How to masturbate safely, men over 60. If you're a man over 60, you may have started noticing shifts in how your body responds to sexual stimulation. Maybe arousal takes longer, maybe your erection doesn't feel as strong as before, or perhaps sensitivity has changed in ways that confuse or concern you. These changes are normal, but the problem is that most men continue using the same habits they used in their younger years, unknowingly putting pressure on their prostate, nerves, and blood vessels. When ignored, these small habits can slowly lead to long-term discomfort or reduced pleasure. But with the right understanding and a few simple adjustments, you can restore comfort, protect your health, and feel more confident than ever. In this video, you'll learn what's happening inside your body, what habits support safety, and how to maintain strong sexual wellness at any age. My name is Dr. MD Rina, and for 3 decades, I've helped men, especially seniors, understand their sexual health without shame or fear. Every week, men over 60 come into my office worried about reduced sensitivity, slower arousal, or uncomfortable pressure afterward. And almost every time, the issue isn't a disease, it's just a lack of knowledge about how the aging body works. You being here shows that you want clarity, and I respect that. For the purpose of this video, please subscribe and turn on the YouTube bell for more. Today, I'm going to break down these changes in a simple, calm, encouraging way so you can feel in control again. Let's take a deeper look into what truly happens inside your body as you grow older. Inside your body, 3 systems must work in harmony for healthy sexual function: blood circulation, nerve pathways, and hormonal balance. As you age, each of these systems slow slightly. Blood vessels lose flexibility, meaning they need more time to open up fully. Your nerves become more sensitive to pressure and friction, so harsh stimulation can overwhelm them instead of creating pleasure. And testosterone, the hormone that drives libido, naturally declines, making arousal slower and recovery longer. The prostate also becomes more delicate, almost like a valve that prefers smooth movement over sudden force. None of these changes mean something is wrong with you. They simply mean your body needs a gentler, more mindful approach. What most men don't realize is that everyday habits affect their sexual comfort even more than aging does. Dehydration thickens the blood and raises cortisol, restricting the flow needed for strong erections. Stress tightens the pelvic floor, reducing sensitivity and making arousal feel weaker. Lack of sleep lowers dopamine, which directly affects interest and enjoyment. Even sitting too long can create tension in the nerves that control sexual response. And mental distraction, thinking about bills, work, or worry, signals your nervous system to shut down arousal because it doesn't feel safe. Many men mistake these factors for old age, when in reality, these are reversible conditions that create unnecessary strain. I remember a patient named Mr. Lawson who came to see me at age 67. He looked frustrated and exhausted. He said, "Doctor, my body doesn't respond like it used to. I feel sore afterward, and sometimes I just don't enjoy it anymore." After talking with him, it became clear that the problem wasn't medical. It was his habits. He was rushing, using too much pressure, and carrying stress from work into his intimate moments. He didn't realize that his nerves and prostate couldn't handle the same intensity as in his younger years. Once he slowed his pace, stayed hydrated, relaxed his breathing, and allowed his body time to warm up, everything changed. He regained sensitivity, reduced discomfort, and felt more pleasure than he had in years. His story is extremely common. To protect yourself at this age, you must start with the basics. Slow down your pace so your blood vessels have time to expand. Rushing works against your own biology. Drink water beforehand so your tissues stay comfortable and well circulated. Relax your pelvic floor by breathing deeply. Tension in this area is one of the biggest hidden causes of reduced pleasure. And don't hesitate to use lubrication if dryness occurs. As you age, natural moisture decreases, and dry friction can irritate both the skin and nerves. These simple steps create a safer, more enjoyable experience. You should also pay close attention to the signals your body sends you. If you feel numbness, pressure, or burning, that's your body telling you to slow down or change your rhythm. Avoid treating sexual stimulation like a race. Intensity may feel necessary in the moment, but it often reduces long-term sensitivity. Support your hormone levels with sunlight, zinc-rich foods, and movement throughout the day. And remember that at 60 plus, your body needs more recovery time. This isn't a weakness, it's biology. Giving your system time to rest protects your prostate and helps maintain healthy responsiveness. Something I always remind my older patients is that your body isn't failing, it's evolving. The pleasure pathways that once responded quickly now respond better to calmness, warmth, and gradual buildup. When you stop forcing your body to act like it did at 25, you discover a deeper and more sustainable kind of pleasure. Comfort becomes strength. Gentleness becomes power. Many men find that their intimate experiences actually become more meaningful and more satisfying once they allow themselves to embrace this new rhythm. It's also important to be mindful of the kind of stimulation you rely on. Overly intense visual content can desensitize your brain, making physical sensations feel weaker over time. When you shift your focus to breathing, presence, and physical awareness, your natural arousal system becomes stronger again. And if you ever notice persistent discomfort, pressure around the prostate, difficulty urinating, or pain that lasts longer than a day or two, it's important to get checked. These issues are easier to fix early than later, and no man should suffer in silence. The most important message today is this: your sexual life is not ending, it's changing. And when you understand those changes, you gain control instead of losing it. You can start improving your comfort and confidence today with one simple step, whether that's slowing your pace, breathing more deeply, preparing your body with hydration, or giving yourself more time to warm up. These small choices improve not just your sexual health, but also your energy, mood, and emotional well-being. Healthy sexuality contributes to a longer, happier life. If this video helped you understand your body better, give it a like so more men can learn the same life-changing information. Share it with someone who may be quietly dealing with these changes but doesn't know who to talk to. And in the comments, tell me one thing you're going to start doing differently after watching this. Don't forget to subscribe because in our next video, we'll explore how improving blood circulation can dramatically boost your performance, prostate comfort, and overall vitality. You won't want to miss it.